Hello and welcome to NIAGA Spotlight with me, Tamina Kaushi. NIAGA Spotlight goes through the week in economic analysis and future affairs. Now, today on analysis, it's an IDEVAW 2024 focus on addressing economic violence and life cycle poverty. Well, 25th of November marks the annual commemoration of IDEVAW, which means the International Day for the Elimination of Violence Against Women, and the start of the 16 days of activism, which culminates on 10th of December, Human Rights Day. 1 in 3 women has suffered some form of violence during their lifetimes. Now, shifting to an economic focus, the global cost of violence against women and girls has been estimated conservatively at least $1.5 trillion. Now, a World Bank study found that violence against women and girls can cost 1.2 to 3.7% of GDP for some countries, and emphasizes that these proportions of GDP are what many countries spend on our primary education. So quite clearly, the impact of violence against women and girls goes beyond the individual and affects communities, businesses, and overall economies. Meanwhile, closer to home in Malaysia, a 2023 DOSM report indicated that violence against women, particularly intimate partner violence or IPV, remains prevalent in both urban as well as the rural areas. In fact, some studies are suggesting that more than 50% of women have faced some form of violence, including physical, emotional, or economic abuse and violence. NIAGA Spotlight today focuses on actionable strategies for addressing the root causes of economic violence against women and girls via economic empowerment and gender balance in business as well as finance to break life cycle poverty and its impact on vulnerable women's lives. Dato Dr. Hartini Zainuddin, co-founder Yayasan Chowkit and fundraising consultant, joins me now in the studios for this very timely discussion. Very good morning, Dr. Tini. How are you doing?
I'm well, thank you. Hi, Tamina. Thank you for having me on this.
Not at all. It's an absolute pleasure. Now, Tini, let's get into the nuts and bolts of it, shall we? So you, of course, have worked in the fundraising sector as well as with child rights, but ultimately it really boils back down to who the primary impacted figures are in this situation, which is most often the women or the mothers.
Yes.
Let's talk about some of these structural inequalities which you have noted that are truly harmful, then actually they begin much earlier on in life before women even hit adulthood. You witnessed this firsthand.
Yes, so I work primarily in Chowkit, although I work in the larger area of KL and Selangor mostly. And a lot of the mothers that I see are single mothers who live in PPR flats, who may or may not be educated, but their education is minimal at best for a number of reasons. They married young, their husbands die, or they unfortunately are in situations where, you know, they're forced to take care of their own children and other people's children as well, you know, whether it's relatives, etc. So there's this large group of women that concerns me, not only just because they're single mothers with young children, but they are also elderly mothers now with grown-up children.
That's right.
Who are on their own, who are fending for themselves on very little money and resources to be able to take care of themselves or their children at last, which is why I started the Milk Drive campaign, which is why, you know, we're looking at the school program, which is why we're looking at ways in which we can sort of provide support services for mothers and families in the community, because it has to be a communal approach and a multidisciplinary approach to looking at the situation. It is dire.
It is absolutely dire.
Yeah.
And what you're saying, it actually reminds me of quite often we look at abuse headlines that turn out to be something that a young child has faced. I'll refer to one quite recently that truly, I think it shocked many Malaysians to our core. It was of a young child below 3 years of age who was found being held inside a cage. And the mother and her 3 friends were charged. But I actually looked immediately and zoomed in at the mother's age, not even 19, 20. So that points to someone who would have been pregnant and already had the child, possibly in her mid-teens, 14, 15, right? So actually, this is pointing once again towards the life cycle. Let's talk a little bit about the inadequate access to education, healthcare, and care overall that also leads to very often girls becoming trapped in a cycle of child, early, and forced unions.
Well, I think, you know, if we just go back a couple of years, right, let's talk about coming out of the pandemic. The truth of the matter is so many children. I think if you look at the UNICEF figure, it was something like 37% of children didn't have access to the internet, whether in rural or urban settings, and most of them actually are girls. But even prior to that, many girls were not in school. And given the fact that there was the pandemic and stuff, many girls and many children, many people dropped out of school and the workforce simply because there were no jobs. Or there was just, too long a period where they were out of school, and to get them back into school was one situation. But then how do they catch up with all that learning loss, right? So it's a perpetuation and sort of a culmination of a lot of issues that sort of snowballed into something much larger, where now you're seeing 9, 10-year-olds out of school, mostly girls, because we still have this traditional, societal, patriarchal way of saying girls who, can't go to school or don't go to school have to stay home and take care of their, younger siblings or their older parents or relatives, etc. and stuff, and they don't need school because they can work in the kitchen. So we have this really traditional sense of that. And the fact is, it's always the boys who can always, and it's patriarchal as well, the boys who will have to stay in school, although that's not necessarily true nowadays, because forced labor and child labor, is on the rise.
That's right. So actually, when it comes down to it, right, what we're looking at is that there are more and more incidences because, unfortunately, the knock-on impacts of a pandemic and the lockdowns haven't really ended at all for those from B40 backgrounds. So let's zoom in, because you already did mention the care work and the labor. Now, let's look at the overall impact that unequal distribution of this unpaid domestic work or care labor is actually having on women, because number one, you most likely are from a background whereby you have not been able to access education, even high school education. You perhaps get married early, or even when you're underage, you already have a child, a few children. Then how does your life cycle pan out once you're in early adulthood all the way to your 30s, 40s?
Just to go back again a little bit, it is not a knock-on effect. It is a tsunami. It is an absolute wave of issues that are coming at once. There is no knock-on effect. Everything is hitting you at once. You're sick, you're hungry, you have no school, you have small children, you lost your job, you haven't found a job, there's no daycare, there's no work. Women are not going to go back into the workforce, especially if you're poor. Let's be clear here, the gender disparity happens mostly amongst the poor women.
That's right.
Simply because they never had any resources or education to be able to back them up. So we're talking primarily mothers who are already poor, who are living in abject poverty, trying to climb out of a situation when all these issues are hitting them at once, and not being able to get out of it, actually having to beg for food and keep the children safe. There is no getting out. It's not, the privilege of education is not there for their children. They can barely, make ends meet. They can barely read and write. They can barely find a job. And the fact that the children are not in school, etc. and stuff, they have no resources. They are not thriving. They're going to survive, and their children are going to survive. So there lies your violence of perpetuity and the cycle of poverty. They're not going to get out.
That's right. So this basically is very closely tracking a cycle of generational poverty.
It is.
Because then once again,
it's intergenerational.
Most likely mothers who are already living in this situation, especially single women. On top of that, if they have daughters within their own family structure, the daughters will then, in a sense, be left with not much choice given the socio-economic conditions.
Absolutely. But what I'm saying, what I'm scared of, which I didn't realize before, is that you now have grandmothers living with mothers who are living with children.
Intergenerational poverty.
Intergenerational. You can already see it in urban areas and rural areas, but urban terrifies me because everything is so much more expensive.
Everything is so much more expensive. And let's talk about what kind of access is there actually to make means of making a living for any of these women.
I know, I had a talk with some of the big corporates and financial institutions. And they're telling me about all these programs that they have, because I insisted. I saw a mother crying on the side of the road because, she couldn't sell fruit. one day, and I called up and I said, look, something's wrong. And so they tell me about, you know, these hosts and this myriad of programs that are there, that are available to the poor. And I'm like, yeah, but it's not reaching them. There is no communication, there is no information, there is no dissemination of information. They don't know. And I said, and if you expect these mothers and the poor to come to you, you're sadly mistaken. They can't afford transportation. You should be going to them. You should be going into the PPR flats. You should be going into the kampongs. You should be going down to Padang and getting your data. Your data is outdated. We knew that during the pandemic. We know for a fact you're not sharing information. We know for a fact you're not collaborating on issues. And so where and who is in charge? Some agency, some organization, some ministry, has to sort of coordinate all these data and come up with a master plan to be able to, you know, galvanize and move everyone into action to go down and turun padang and see for themselves. Don't ask them to come.
That's right. We shouldn't have to be waiting for another pandemic, right? So
well, you shouldn't be waiting for them to come to you.
Dig deeper into the same topic, Dr. Tini. I actually want to mention the fact that, okay, when it comes to classifications, hardcore absolute poverty is defined as households earning less than 1,100 ringgit a month. Now, tell me, in your experience with the fundraising that you assist on, not just a daily basis, but it's a constant cycle. Is there an average income even which women's families are making if they are at this level where they're constantly dependent on the kindness of strangers, to put it blankly?
I was down in childcare, right? So, you know, we did a video because I got so frustrated with the fact that children were not getting food. So I had this single mother that we were talking to who lives, you know, in not a one-bedroom flat, yeah? Right. She lives in a one-bedroom that's divided into 3 rooms.
Understood. Within a one-bedroom flat.
Within a one-bedroom flat, and she lives with 4 children, right? Her rent is 600 ringgit in that small thing. They have communal kitchens and stuff. Her rent is 600. She makes, if she's lucky, 150 ringgit washing clothes, which for people, which she rents the washing machine, right? So 150 ringgit times 4 is 600 ringgit, which is the cost of the flat. What about food? What about transportation? What about stuff? She gets some Baitumal expenses to pay whatever it is she needs, but she's got, actually she has 5 kids. One of them is away, her oldest one is away. 4 kids in government school. One of them is in secondary, 3 of them are in primary school. Can you please tell me how this is going to work?
Exactly.
Because you don't.
So all your daily efforts go towards housing everyone.
If you wash maximum 150 ringgit a week, you get. If you're lucky.
That's right, exactly.
How are you going to
So this is one aspect of the cycle which is a continuum, and you have observed it increasingly so, especially in the urban areas of Kuala Lumpur. Now let's go a little bit deeper, Dr. Tini. Let's explore some factors, common ones, which actually place women at greatest risk of overall violence when it comes to relationships. How many of the requests in that sense? That would be numerically. But, you know, qualitatively speaking, as an oversight, given your years of work in the United Nations and understanding the frameworks, what do you think is actually happening?
Of violence against women, the numbers, a lot higher than we think. I would say, but I work primarily with the poor, almost every mother.
Almost
every woman.
Far more than the 1 in 3.
Far more than the 1 in 3. Some kind, definitely all have economic violence inflicted. Almost all had, no, actually all, some form of physical or violence. All had emotional violence. All.
The entire spectrum. And also, I think there is an opportunity here to look at policy-related interventions which recognize that living in situations of economic hardship actually place a lot more further pressure amongst even couples. So we're not just talking about single mothers, but we're talking about women who are in marriages where the socio-economic structure is from lower backgrounds.
Yes, simply because either the woman and the husband takes off, or, you know, there's violence, there's frustration, there's no jobs, there is emotional
unemployment.
Stress. Absolutely, absolutely. I had a mother with 6 kids in Sabah whose husband she was telling him because she needed clean water, and she asked him to go get water from the well, which was away, and they didn't have money to buy the pipe. Anyway, long story short, he took off, or she kicked him out for 1 week and she told me, and she was apologetic, but I get it. She said, you know, I have to take him back because I can't survive with 6 kids. Someone has to put food on the table, and I shouldn't have scolded him because I wanted clean water. I should have just done it myself. And I thought the self-esteem, the heartbreak is, it's
There's
just
a lot
terrible.
of refraction when it comes to...
But the violence, right? The husband who never hits. Because he's frustrated because there's no job, and because she's the woman, right? She feels she's powerless to be able to get out of the situation, that she has limited choices because she's not in school, because she doesn't, you know, she doesn't work, and she depends on the husband because she's been told this is what you do, and she has 6 kids who are not in school and they have no money.
Exactly. So that's one snapshot of how that might be affecting one singular family. However, we then zoom out and we go into discriminatory labor practices. Let's talk about the type of work in greater depth that women from such backgrounds that are already economically severely restricted are able to find. What kind of barriers are they facing when they do go out to work? Generally, though, in the informal sector.
It is in the informal sector. Most of the mothers I know work in the mamat stalls and the gerai-gerai makan, or they work as, you know, salespersons, or they work in jobs that they get paid daily. So I've met women, mothers in Klang, who, you know, go and they work, you know, 3 times a week just packaging boxes and putting things in boxes. So their income is not stable. You know, and because, you know, and this is with Form 5 education, you know, and there's just no time for them, even if they had dreams, and many are smart, very, very smart, who just never had the opportunity to further their studies. Even if they wanted to go to night school or to go to adult education, they simply don't have the time because they have kids, they have, you know, responsibilities and stuff. They're so tired. Many of them don't work 1, 2 jobs. Many of them work 3 jobs. There is just no time. They get sick. There's no insurance. You know, we saw that insurance is going up 40 to 60%. I laugh because
even,
you know,
the middle class is going to, of course, face constraints with that. What to speak of anyone from B40
no
or
one's
lower.
going to be able to afford insurance. So when you get sick, this is what the mother said to me. One mother said to me, she says, I can't afford to get sick because if I get sick, they cut my pay. And she's a kindergarten teacher,
That's right. Exactly.
She's a kindergarten teacher with 1 child whose husband died. She says, I cannot afford to get sick because if I get sick, they cut my salary and I only make this much, I can't pay rent and I don't have food.
So this also speaks to a wider trend that it's observable of occupational segregation, not just the gender pay gap, right?
Absolutely. Absolutely. I think, you know, a lot of the jobs that they have are temporary. A lot of the jobs that these women have...
They're in feminized sectors as well. Very much
feminized sectors as well. Very, very traditional in terms of what kindergarten teachers, not nurses, not so much, but kindergarten teachers, like I said, those working in the informal sector, like mamat stalls, making kueh, is a big one. And that's another one. They're like, what do you want to do if you were we were to upskill and to help you or to give you extra money, right?
Exactly.
To be able to do. They're like, I want to cook. And I'm like, okay, but what else would you like to do? Would you like to learn how to use a computer? Would you like to, you know, see if you could, you know, take a class to do a diploma? Especially if, you know, we know you're smart, you can do this. Like,
yeah, so it's all about actually the skills transference, which does not necessarily occur. So Tini, from there, let's draw the conversation into perhaps your ideas for ensuring that women who are not necessarily part of the formal labor force also are able to access some form of social protection.
Well, I think that, first of all, like I said, I think, you know, the agencies and coordinating bodies should actually go down in Turun Padang and have the programs on site with where the mothers are.
So district by district, so that it's manageable.
Area by area. Start with your neighborhood, right? How many women in there need help? With what? Food is a good way to... Hunger, it unfortunately is a way in which it's an entry point to go in to see what's going on in that household, in that family, in that district, in that neighborhood, to sort of go in and see what else is needed, right? But I think, you know, the support services, the programs that, you know, this myriad of programs that we have for the poor isn't reaching them. So why don't you bring them to there and see how you can implement them within the area or district yourself, right? And get that to happen. I think you also need to, we need to stop thinking we know what's best for the poor.
That's right.
I think, and we need to stop thinking we know what's best for the mothers. Why aren't we asking these mothers what they need instead of assuming we know? I think when you ask them, they will tell you it isn't education so much for the children, it's a roof over their head and a means to survive. And then if you ask them, they don't even dream. So you say, cita-cita, nak jadi mimpi apa. They're like, huh? They're just too busy. So if you give them that space to sort of think about their future and plan their future, and to give them a breathing room to be able to plan, whether it's financial literacy, food literacy, you know, skills like what can you do, where are you, where's your assessment, that would help a lot.
Absolutely. There's a clear need from everything that you're sharing, Tini, from the grassroots work that you do, to rethink poverty intervention and to specifically cater plans and programs as they roll out, looking at the gendered needs of women.
Absolutely. I think everything should be done. The budget should be planned through a gender-based lens. You know, what we should be looking at is systematic change, not just to district. Yes, we could do that as pilot projects, but we should be looking at systematic change and understand and really get to the root causes of what is going on. Food baskets are not going to do it. Coming in with an educational program to intervene, to say, oh, this is what we're going to do to help the kids, you know, catch up is not enough. Get to the root cause. Let's
float something which is a much bigger perspective. What about recommendations for like a universal childcare allowance and universal allowances?
You know, UNICEF has been asking for that universal welfare allowance for the longest time. And in fact, I was talking to someone else, and we had this, UNICEF had this consultation thing on universal healthcare and universal welfare care about, you know, the need to be able to give that extra money to those deserving so they can use it, not restrict, and not limit, so they can use it for whatever basic needs is needed, to pay shelter, to pay for health, pay for whatever it is. We really need that for them.
Yeah, the cash transfers ideally would come up to
not vouchers. I don't think vouchers will work.
Not vouchers, because of course those who are within that situation themselves, the mothers, they know exactly how to utilize the money. Let's talk a little bit about the role of PPPs, public-private partnerships, when it comes to filling in the gaps before perhaps we have overall budgetary policies that are allocating maybe 3.2 billion overall for these allowances.
So one of the areas that I'm looking at is actually healthcare for marginalized mothers and children. And so looking at ways in which the NGOs can collaborate with the corporates and government agencies to be able to work in this health issue, right? And then looking at the pillars right across, whether it's screening or helping with delivery charges, mental health checkups, etc. and stuff, and making sure that pregnant mothers and children have their needs addressed. Also because my biggest concern now, because of everything that's happening, is malnourishment and malnutrition in this country, right? So stunting's gone up, anemia among pregnant mothers and children have gone up, obesity has gone up, and people are not eating because they're hungry, It goes back to, so we need to address this issue, but to address all that issue, you need to go back and look at public health education, and we need to go back and ask, mothers especially, what do you need? Families, what do you need? Women, what do you need? We need to talk about child marriage. We need to talk about domestic violence at home. And we need the policymakers to say, this is what we need to do. You're wasting money if you don't. Let's just put it that way. You're flushing money down the toilet if you don't address this properly.
Exactly. So it's all about having not just a systematic method of framing it via a gender lens to particularly point out where and when our women and girls are being particularly impacted, but everything points back to malnutrition and the intersecting realities of children living in poverty. Actually is quite often invisibilized, that the mothers, the women are facing the exact same thing. So let's bring it back now. Let's look at the perpetuation of economic violence against women and girls, Tini, but your future forward thinking for moving past the fundraising step into a structure that at least as pilot projects can be rolled out so that at least those on policy-making levels are able to see the direct knock-on benefits and then are able to be galvanized to roll it out across the country to hit every pocket where this is present?
I'm actually having discussions with, representatives from different government agencies. I think because now they understand they have to tour Padang, they have to work with NGOs, they have to talk to the mothers and find out, like, where are they, right? Why aren't they coming? And I'm like, this is what you do. And I think, obviously, it is not one organization, one person, one agency's job. It's everybody having to work together and then, coming up with a master plan and hitting it from holistic points of view. But it goes back to this, which, I think is very important. And it's a lesson I learned. I only work on child protection. And I always thought, I don't work in anybody else
not
above
your arena,
18.
perhaps.
It's not my arena. I don't work with women. There's so many amazing women out there and stuff, until I realized you can't protect children if you don't protect mothers, and you can't protect mothers if you don't protect the community.
Exactly, and it's because it's not the women it's not the children who are texting you and asking you constantly for the food emergency.
It's the mothers.
It's the mothers, it's the women.
Yeah, it's the mothers. And so and I also realized over the pandemic, the group that takes care of everybody in the community and the next door neighbor are the women.
Absolutely.
It sounds really this thing, someone asked me yesterday as well, it's like, are you a feminist? I'm like, what does that mean? I am a feminist if it means excluding any woman, any girl from any basic needs and making sure that making sure that they thrive, right? Then yes, I am a feminist. But if you're asking me to go out and, and say, I'm taking away the rights of someone else to promote the rights of women, then no, that's not what I'm doing. That's not what it's about.
I think I'd like to just end with a statistic that stood out to me quite recently, which was released, of course, and discussed by the Ministry of Women, Family, Community Development, that there have been close to 44,000 and above unintended pregnancies over the past 5 years.
Yeah,
the statement
a lot higher than that.
Was of course made, this is data that's collated, that the majority of those were actually amongst underage girls who are married. However, once again, that being 0.13% of the Malaysian population, it brings up the wider question. How many of those girls, once they grow into full womanhood as well, already pregnant as girls, will then lead to a life cycle of economic violence and poverty? Tini, thank you so very much for your time today.
Thank you so much for giving me the
It's been a really insightful discussion.
Same here.
Absolutely.
Thank you. Thank you again.
All right, well, that's all we have time for today on NIAGA Spotlight with me, Tamina Kausji, signing off for now, and we'll see you again next week with more business analysis and economic insights. Here's to a productive week ahead.